Kia ora. Tēnā koutou, tēnā koutou katoa, tēnei te mihi atu kia koutou, kua tai mai I tēnei pō, tēnei ahiahi, tēnā koutou. Te mihi tuatahi ki ngā mana whenua o tēnei rohi ko ngā tai ki tāmaki, he mihi anō nei ki ngā huamati ki te whānau Michael Mosley, haere atu rā. He mihi anō nei ki koe Maria, ki a koe Jim. Thank you very much for having me this evening, this afternoon, or this morning, depending on where you are, to talk a little bit about the World Federation of Public Health Associations and where we fit in this picture. I've just introduced myself in my language, Te Reo Māori from Aotearoa, New Zealand. I've said hello to you from the land of Ngā Tai ki Tamaki, which is the tribe of the area on which I live. I've also acknowledged the passing of Dr. Michael Mosley, which is appropriate for me to do in my culture at the beginning of any speaking engagement, is to acknowledge those people who've gone immediately. And also to you, Maria, it's great to see you again, and Jim, and also to see half of Howard Catton just before in the screen. Haven't seen you for quite some time, and also to say greetings to you all around the screen, around the world this evening. I am the new president of the World Federation of Public Health Associations as of the 29th of May. So this is technically my first official engagement, so thank you for that. I don't normally write my speeches down, but I have this evening, given that it is, as Jim alluded to, just gone midnight here in New Zealand, body clock all over the place, having just arrived home from Geneva, and the importance of the number of messages that I want to give around the shape of the Federation, the capacity of the Federation, and also our commitment and direction where we're going in line with this work. And I also want to take the lead of Maria in her comments right up front, which were very truthful and honest around, the effect that we're having as humans on our planet. And I think the words were, the world is heating up and it's our fault. So I'm going to tell a little bit of a story, and then I'm going to give you a bit of information about where we're at as the Federation. For those of you that don't know much about the Federation, I invite you to go to the website, WFPHA.org, but I have put considerable information through the next part of my talk. Also, the Executive Director, Bettina Borish, will join you for the second half of today's meeting, as I will take my leave at some point to go and get some sleep in the interest of well-being. So, I just also want to acknowledge that here in New Zealand, it's Matariki. This is our new year. We celebrate New Year at this time of the year. It's about aligning ourselves with the stars and the phases of the moon. And when I say ourselves, us as Indigenous peoples here in New Zealand, I am Indigenous, and so everything that I talk about will be flavoured with Indigenous health in mind. So I'd firstly like to read an email that my mother received after my inauguration as president of the Federation last week. It's from her cousin in Australia. It says, and just for a bit of context, she's a 79-year-old white New Zealander, and he is a 79-year-old white Australian. She was a nurse for 50 years, and he is a climate scientist. So this is the email. Dear Mary, our niece sent me the news of Emma's new position with the WFPHA. My hearty congratulations. I think her generation has more hope than ours of fighting to correct colonial injustices. Her pure white colleagues are more likely to accept that colonisation was morally bankrupt. A neighbour of ours does a lot of work with Aboriginal communities, facing a lot of opposition from those who believe in civilising the savages. In my own area of professional involvement, the science of climate change, acceptance of what needs to be done, is probably in an even worse state than fighting for cultural justice. Even in the face of ever-increasing storms, floods and bushfires, not even my green friends think twice before flying to Europe for a few days. Few accept that sustainable growth is pure oxymoron. Love, Stuart. I think this email depicts a wonderful set of circumstances that we may advantage ourselves by understanding. Indigenous peoples number close to 500 million of the world's population, all sharing a similar symbiotic relationship with the planet. Indigenous ways of doing and being have forever been inextricably linked to cohabitation and survival with the planet as a source of life and thriving. Values-based Indigenous lens is imperative in all that we create, implement, and or return to in our practice. As the leader of the WFPHA, an organisation that houses and supports the broader public health community, public health medicine practitioners, policy writers, analysts, advocates, academics, health promotion specialists, bin men, barbers, doulas, rongoa traditional medicine practitioners, epidemiologists, health economists, dentists, researchers, and many more. We are well placed towards the broadest public health application and implementation of efforts to address climate emergency as it relates to all determinants of health. Messaging and education is the key to informing and engaging the public in efforts towards the public's health. Consistency and competency and understanding, but also ability to articulate and translate that the climate and its demise is central to all our health and well-being, is paramount to the success of any resolution, framework, or model of anything. Indigenous populations must be central to the considerations also, as traditional knowledge systems and ways of caring for and healing the planet are and have been around since time immemorial, and engaging Indigenous communities to help us all understand best practice is about trust and reciprocity. Indigenous populations are greatly, if not more greatly, affected by climate change and therefore increased inequities in health and life circumstance. Rising waters in the Pacific, higher instances of infectious diseases, food insecurity, and economic instability, to name a few. There is a well-known saying in New Zealand that if we prioritise the health and well-being of Indigenous populations, those most affected by inequity, then we will by default raise the health and well-being of all. I think the reference in the email my mother received to the notion of the continuing idea of civilising the savages is a helpful reminder that not seriously listening to these significantly affected populations, not equipping our decision makers, our public health workforces with substantial understanding about the importance of this focus is in some way a blindfold to that notion. So I would suggest that there are some very key understandings we need to reach in regards to partnership approaches to climate health that authentically ensure our practice and implementation is aligned to best outcomes for those who have and will be most affected, while valuing the gift of the knowledges that have always protected planet and people in the most sustainable ways to benefit all. The WFPHA goals of advocating for peace, promoting sustainable health equity, and developing global policies aimed at enhancing the health of populations and the planet, including a focus now towards systems change and decolonising public health, which is particularly about education and implementation of tools that create change in practice and delivery, that rebalance the distribution of resources and prioritisation to greatly address inequities in the most effective ways in all the contexts of how health is determined and how health and well-being is accessed. This prioritises the planet as the most important factor in human survival: air, water, earth, the ecosystem that simply provides life and home. Policy and mechanisms to embed equitable practices at the very core of society, systems and governments are what I think we are all aiming for. And our public health workforces can be a force of change to advocate and action these changes, because we are all at levels of society working on all areas of the determinants of health all of the time. It is certain that there needs to be coherency and clarity of voice, which takes me back to consistency in education, competency and focused implementation. The WFPHA has over 110 members, over 5 million individual members that, as mentioned earlier, consist of a very diverse workforce at many levels of influence. We have a program of work and strategic plan, ever developing opportunities, which align well with advocating for and implementing actions to support the goals of the WHA 77 resolution on climate change. Currently, several of our very active working groups, environmental, public health professionals, education and training, Indigenous and young WFPHA, as well as others, have been working towards actions and advocacy that are already impacting in this space and are now working on stronger collaborations and alignments with each other and through broader networks. The WFPHA is happy to support and promote through our organisation networks, advocacy and influence in workforce education and public health, the continued work on and towards climate change, climate sustainability, and continuing to influence our workforce and members to adopt best practice for best outcome, public health for all the public's health. He manu kai a te miro nona te ngahere, he manu kai o te rangatira nona te ao. The bird that eats the berries, his is the forest. The bird that eats the food of chiefs, education, knowledge, and conversation, his is the world. So thank you. I appreciate the time and the sharing, and I hope that all of the messages therein will be received. There was a lot, but I really stand with the notion of promoting positive aspects of climate change mitigation, and prevention and promotion are key. So thank you very much, Jim, and Maria, back to you. Kia ora.